Thanks, Kim. And there is a difference. It's important, in fact, to remember that every person views pain in a different way. So it's critical to understand what your body is trying to tell you. And here to help us with this is physical therapist and certified athletic trainer, Monica Baker. Thanks for joining us, Monica.
Thanks for having me.
Well, tell us a little bit about some of the bad pain associated with exercise.
Well, you know, the old adage, no pain, no gain, is not always true. Not all exercise should be comfortable, but it also shouldn't be extremely painful as well. Any sharp, knife, stabbing type pain is obviously a bad pain. Anytime you might feel a pop and feel immediate pain is obviously also not so good. So those are types of pain that you want to avoid. Burning in the muscle while you're doing the activity, that's pretty normal. That means those muscles are working.
So that's the good pain.
Yes.
Now, what causes the bad pain?
The bad pain is usually an inflammatory response from your body. It's telling you that there's been some damage to the soft tissue structures in that area.
Now, so if your body is sending signals and you're ignoring them, what can happen?
Well, it can result in a more serious injury. Chronic tendinitis or even muscle tears can occur if you ignore those signs.
So what's the best way to deal with an injury?
Well, one way to do is treat it with RICE, which is rest, ice, compression, and elevation. So you can take a gel pack here, which you keep in the freezer, or you can make your own by using a Ziploc bag with 2 parts water and 1 part alcohol, and then stick it in the freezer and let it freeze. It'll be kind of soft and jelly, so it conforms to an area real nicely. So you want to put the ice on there for about 10 to 15 minutes. If you put heat on something too soon, you can actually make the inflammation worse and make your pain worse. So the best way to treat it is with ice. If the pain persists for more than 5 days, you need to seek a physician and get it checked out and make sure there's not something serious going on in that area.
What about exercise? So we've injured ourselves during exercise, so should we do any exercises to make ourselves feel better?
Well, one key too to notice is that if you are having pain during the exercise, if it doesn't go away after the first 5 to 10 minutes, then that's the key to stop the activity and rest it. Or to seek a physician if it lasts for more than 5 days. Everybody's injury is different, so it will depend on the injury and your recommendations from your physician on when to begin exercise again.
What about using a bike? We see a lot of people when they're injured
get back on. It's a nice low impact, and this is great for soreness because it's a light, gentle activity that will help pump that lactic acid that builds up in the muscles to help get it out of there, which is the best thing you can do for muscle soreness. So if you've had a hard workout, you're really sore the next day, having a hard time moving, a light bike or walking is really good to pump out the lactic acid.
Well, great. Thanks so much, Monica.